Hello, my dear colleagues. I'm Dr. Yaşar Başağa. I'm Doctor of Urology and Andrology. We have an andrology clinic based in Istanbul, and I have completed my PhD level in stem cell sciences 2 years ago, and we use regenerative treatments in our clinic, generally in andrological practice. Today, I would like to talk about the advantages of SPF preparation and the steps of preparation of SPF with G-cell kit. We're using G-cell kit, that's why I will explain that's why we're using it and the advantages. First of all, I would like to talk about the SVF. SVF is the acronym for stromal vascular fraction. What's stromal vascular fraction? There is then stromal component which is composed of mesenchymal stem cells, extracellular matrix proteins, and the skeletal proteins and the skeletal components of the extracellular matrix, and the pericytes, fibroblasts, and other normal collagen component of the extracellular matrix. It's really very important to prepare a good SVF. Why? Because one of the most important points in the SVF preparation is the number of the cells and the ratio of the mesenchymal stem cells in the total cell population. We know that the most regenerative component of the stromal vascular fraction is the mesenchymal stem cells, and we want to separate mesenchymal stem cells in high ratios in the SVF preparation. For SPF preparation, the easiest way is to use abdominal fatty tissue. The oldest way, we can make SPF preparation mechanically or enzymatically. For enzymatic SPF preparation, we have to take permission from Ministry of Health, because in EMA regulations, the enzymatic degradation of the fatty tissue is accepted as advanced medical products, or has to be for injection of advanced medical products. You have to take permission from Ministry of Health for each unique patient. But for mechanical SVF preparation, you can do your products without any permission. For mechanical SVF preparation, generally we use mechanical blades, and these mechanical blades start from 2400 microns to 600 microns. You can use those with your hand and your power, and you cannot use 300 micron blades because it's really very hard to use it with your hand. But with this G-cell kit, we use an automatized system, and the system has the 350 micron blades, and these blades are the blades that you cannot use your power and force, and it's more powerful than normal body. When we do a cell count study, when we use older mechanical preparation systems, we know that there are around 10 millions of cells in the SVF. When we prepare the SVF in the same patient with the G-cell kit, we can collect up to 130 millions of cells. The cell count and the ratio of the stem cells are really very high with the G-cell kit. Why? Because by the hand power, we cannot force cells to separate from the SVF, and by the machine power, we can separate cells in high ratio and in higher number with the G-cell kit. I will put the result of the study from here, and you can contact me and take study results and flow cytometry results of this study from me. This is one of the most important advantages of the G-cell kit. By the help of the G-cell kit, we can just collect 15 milliliters of fat, and after collection of 15 milliliters of fat, we can easily get enough numbers of cells for the treatment of erectile dysfunction, Peyronie's disease, or other diseases. Because when we are using the mechanical older kits, the hand power kits cannot collect enough cell count in 15 milliliters of fat. You have to do higher volumes of lipoaspiration. When you perform higher volumes of lipoaspiration, you have to use adrenaline for the tumescent fluid. Why it's important? Because when you use adrenaline causes 50% of cells death. Adrenaline can cause death of cell population around 50%. I will also put you here the values, and you can see it easily that around 50% of cells go into shrinkage after adrenaline injection. For the tumescent, for the 15 milliliters of fat, we can do without any adrenaline injection, and we don't cause any hemorrhage or hand bleeding for 15 milliliters of fat. It's a safe and effective and fast procedure, and you can fast collect your fat, and you can fast prepare your product in sterile conditions. Let's start the preparation of the SVF with the G-cell kit. First of all, we start with the anesthesia. There is two landmarks in here. The first point is umbilicus. The second point is anterior superior iliac spine. There is then square area here. You see there is a square area here between the umbilicus and the anterior superior iliac spine. We inject local anesthetic between 2 points. I use generally 40 milliliters of local anesthetics because I don't want any tumescent. I just want to make a local anesthesia. I don't use any adrenaline because I know that adrenaline kills 50% of my cells, and I just use local anesthetic. I start from the anterior superior iliac spine. I give 20 milliliters of local anesthetic in radial manner, and then the opposite side I start with the other 20 milliliters and use local anesthetic for the opposite side, control for the distal area. It's really very important to know that the local anesthetic has to be faster response to local anesthetics. I use lidocaine and bupivacaine in combination, and it really gives us a good control for acute phase and for 3-hour manner. After local anesthesia, you can wait for 15 to 20 minutes, and then you can start with a point that's closer to the anterior superior iliac spine, and then you can do an easy lipoaspiration. Lipoaspiration is an easy and fast procedure. You have to be parallel to the skin. You have to feel your cannula under the skin, and around in 1 minute you will collect your fatty tissue around 15 milliliters. 15 milliliters of fat is enough. You can collect it, and then you will put this fatty tissue into this black box. Black box is for the preparation of SPF, and you will close the box, and then you will put it into the G-cell machine. In G-cell machine, we know that there is a special program for preparation of adipose tissue SPF, fatty tissue SPF. You will just put the button and start the procedure. After 12 minutes centrifugation, the blade system, you will take out your black box, and after opening the box, you will collect by an injector the 10 milliliters of preparation. This preparation is called nanofat. Nanofat is the regenerative product, regenerative fatty tissue. When you start with the fat, you can use 2,400 blades and you can get macrofat. After 1,200 blades, you have microfat. After 600 blades, you get nanofat. In this machine, you are getting thinner fatty tissue bladed in 350 micron blades, and this is really very important because after filtering, you are getting a high regenerative potential. You know that microfat, millifat has also regenerative capacity, but the most regenerative capacity is found in nanofat component. Others can be used as filling. Microfat, minifat has potential of filler capacity, but the nanofat has the potential of regenerative capacity. You can inject this into any area of hairs or skin. You can inject nanofat and you can use regenerative capacity of nanofat. But if you are going to use in a vascular space, just like penis, you cannot inject this nanofat into the penis. You have to get soluble. This is an SPF product, nanofat SPF, but for the vascular components, vascular areas, you have to get soluble SPF because there is fatty tissue in this component, and we cannot give fatty tissues, fatty cells, fatty components into the vascular spaces. For centrifuge, we use PRX tubes. After putting the nanofat into the PRX tube, we are making a centrifugation of 10 minutes and 400 RCF. We have to centrifuge them, and the centrifuge has to be 90-degree angle because we want to collect the cellular component of the SPF at the bottom part of the PRX tube. After 10 minutes of centrifugation, you are going to see a special tube component. The lower part is the pellet, which composed of cellular component of the SPF. This is the most important part. After collection, we want to collect this pellet and cellular pellet. In the upper part, there is then water component. In the upper part, extracellular matrix, and the upper part is the triglyceride and the lipoic component of the SPF. We collect the pellets. It's the most important part. Even this can have adipocyte and big fatty lobules, and we inject this one into the vascular space. We can cause any ischemia. We can induct then clot formation. It's risky. We have to filter this solution with the 40 microns because we know that fatty lobules lower than 40 microns is not important for us. Lobules over 40 microns are really very important, and we cannot inject them. After filtration, our soluble SPF product is ready. But in G-cell machine, there is a special feature which is called photoactivation. Photoactivation is also in our cell count studies. We detected that the photoactivation increases the cell count around 30% because there are some cells that after SPF preparation, and we can activate them by the photon energy, and by this energy around 10 minutes of automatized system and the photoactivation, we get 30% of more active cells in our SPF compound. I regularly count my cells with a tryptophan blue based cell counter, and almost always I see a count of over 20 millions because my device counts up to 20 millions. I have to delete it at least 5 times, and then I do my counter, and then I'm sure about the number and the vitality of the cells, because I want to get vitality over 20%, because if you are not getting enough cellular capacity and vitality, it causes a less effective treatment after regenerative treatments, because preparation of SVF, cell counts, mesenchymal stem cell ratios are really very important to get an effective regenerative treatment, because nowadays people and doctors think that regenerative treatments may be fake, but if you prepare a high quality product, you can get a better result after your regenerative treatments. If you have any question, I put here my contact, email number and phone number. You can contact me and take detailed information about preparation of SVF, stem cells and exosomes.